Hey everyone. Memorizing drug cards can be a real pain, but it's necessary. There are a few things that can help. My recommendation is to make 3 sets of drug cards, not one set, where you put everything on that set. So on the first set of drug cards, you're just going to put the dose and the route of each of your drugs. On the second set of drug cards, then you'll put the name on one side, and then you'll put just the indication and the mechanism of action for that drug on the opposite side. That's your second set. And then your last set will be the name of the drug and just the precautions or contraindications. If you create those 3 sets and you learn them first, dose, then the indications and mechanism of action, and then finally the precautions, you'll find it's a lot easier than you think. So let's look at the first set of drug cards. So on one side you'll put activated charcoal, and on the flip side you'll put adult dose, 25 to 50 grams, not milligrams, 25 to 50 grams, and then put PD, half of that, 12.5 to 25 grams, and then the route is PO. That's activated charcoal. The next one is an EpiPen. An EpiPen is an adult dose of 0.3 milligrams, not 3 milligrams, not 3.0 milligrams, 0.3 milligrams for an adult, and pediatric is half of that, and half of 0.3 is 0.15 milligrams, and that's given IM injection. Aspirin is the next drug card, and so on one side you should put the word aspirin, on the other side you put 160 to 325 milligrams PO by mouth, and remember that it's chewed, not swallowed. So you chew it. You can take one adult aspirin, which is 325 milligrams. But the problem with that is it's very bitter. If you've ever tried to chew an aspirin, an adult aspirin, you find it's extremely bitter. The other option is to take baby aspirin, and you give your patient 4 baby aspirin. Baby aspirins are 80, so 81 milligrams each times 4 is 324 milligrams. So often ambulances carry the baby aspirin. On your next drug card, you put nitroglycerin, NTG, on one side, and then you put 0.4 milligrams, and then it's SL, sublingual, and it comes as either a tablet that goes underneath the tongue, or it also comes as a spray that you spray underneath the tongue. Your next drug card would be Narcan or naloxone, and the dose is 0.4 to 2.0 milligrams. Again, not grams. So everything so far has been milligrams with the exception of activated charcoal. So Narcan is 0.4 to 2.0 milligrams, and that's intranasally. Your next drug card is oral glucose, and that's another one that is grams. It's 25 to 50 grams, but it's about 1 tube. It comes in a tube, and that's PO or buccally, which would be against the inside of the cheek. Now, sometimes you're not going to use the actual tube. If your patient is conscious and he can drink orange juice, you can give him orange juice. Oxygen is your next medication, and you've done that already, so it's 1 to 6 liters per minute and 10 to 15 liters per minute if it's high flow. And your last drug would be a rescue inhaler, an albuterol rescue inhaler, and that would be 1 or 2 squeezes, and that's whatever the prescription is of the doctor, because you're assisting a patient taking his own inhaler. So let's try a question. A mother and a young daughter both carry an EpiPen. What is the dose of the child's EpiPen? 12.5 grams, 0.015 milligrams, 0.15 milligrams. So you have all the different dose options, but you don't actually have the names of the meds. But you should know once you study them, that adult 0.3 milligrams and PD 0.15 milligrams IM is the dose and the route for epinephrine for an EpiPen. And since this is a child, it should be 0.15 milligrams. On the second set of drug cards is a completely new set of drug cards. You're now going to put all of your medications on one side, and then the other side, you're not putting any doses. That's all you're going to do is put down what you give it for and what it does. So for activated charcoal, on the other side, you're going to put poisoning or OD. And then you're going to put it binds or adsorbs, and there have been test questions where it says absorb AB or adsorb AD. And so it adsorbs, which means the activated charcoal doesn't take in the poison. It lets the poison attach it to the outside of it, kind of like a sponge that you squeeze, and then you get all the water out of it, and then you take that wet sponge and you touch it against some sand. The sand doesn't actually go into the sponge, it sticks to the outside. That's adsorbing the chemical. So activated charcoal. And then an EpiPen is for anaphylaxis or severe allergic reactions. It bronchodilates the lungs and raises the blood pressure. Aspirin is used for chest pain, but not for the pain. It helps to prevent any further clotting. Then nitroglycerin is also used for chest pain, but it's not used for the pain. It's used to dilate the coronary arteries that supply the heart with blood. And then Narcan or naloxone, it's used for narcotic overdoses, heroin, fentanyl, and it blocks the effect of the narcotic. It's a narcotic antagonist. Then oral glucose, it's used for hypoglycemia, low blood sugar, and it raises blood sugar in diabetics. Then there's oxygen for hypoxia, and it raises blood oxygen levels and tissue oxygen levels. And there's the rescue inhalers, the albuterol, and that's used for asthma, and it bronchodilates the lungs. Your final set of drug cards include the precautions and the contraindications. So let's look at the first three, which are the big ones. So nitroglycerin. Nitroglycerin is contraindicated if the blood pressure is below 100. I know there are some charts that show the blood pressure can't be below 90, but we're using 100 millimeters because the national uses 100. Also, you cannot administer a second dose of nitroglycerin if the blood pressure after the first one drops by more than 30. So if you have a patient that's got a blood pressure of 150, and then you gave him a nitro and it dropped down to 110, well, 110 is still above 100, but you can't give it to another one because he's dropping too much with each one. So it would be contraindicated for a second dose. Then it's also contraindicated with recent erectile dysfunction medications, okay, such as Viagra and Cialis. Now, just because they have a past medical history of taking it doesn't stop you from administering the nitroglycerin, but it does mean you're going to have to ask the question, have you taken the Viagra or the Cialis in the last couple of hours? Make sure you can recognize the generic versions for Viagra and Cialis. Sildenafil and tadalafil. One of the ways to remember is that many of the erectile dysfunction medications end in AFIL, because you may see the generic version on an exam question and not necessarily the brand name. For aspirin, you want to discuss with your medical control if your patient is having chest pain but also has a history of asthma or has a history of bleeding issues. So sometimes patients say, oh yeah, my stomach bleeds a little bit with it. Well, you talk to the medical control, and if it's a serious enough issue of chest pain, the physician may turn around and say, it's okay, just go ahead and give it to him. It's also contraindicated in pediatrics but you're not going to be using aspirin in a pediatric patient pre-hospital, so that isn't really an issue. And you never use the aspirin to treat fever. You're using it for chest pain, but again, not for the pain, but rather to decrease the clotting possibility. And then another point that's important to remember about aspirin is that you can't use enteric-coated aspirin like Ecotrin because it delays the absorption. Okay, buffered aspirin is okay. And you want to chew the aspirin to increase the absorption more quickly. Activated charcoal is contraindicated with caustic chemicals such as acids and alkalis. It's also contraindicated with heavy metals like mercury and arsenic. And then it is a suspension, so it's a solid that's mixed in a liquid. So you have to shake it before you have the patient drink it, along with a large glass of water. And it's important to remember that activated charcoal isn't going to really work if the poisoning or the overdose was like more than 30 minutes or so, because now it's already past the stomach and it's into the intestines. But that would be, you could get that answer from your protocols or from the medical control physician as to whether they wanted to try it. Your other medications are pretty easy. EpiPen, there's none. There's no contraindications with severe anaphylaxis. Oral glucose, there's none when there's hypoglycemia and confusion. Your patient can be confused, doesn't know where he is, and is speaking crazy. But if the patient is actually unconscious and can't protect his airway, then obviously it's contraindicated at that point. And you need to understand that unconsciousness is a contraindication for all oral medications. And being allergic to a drug, not just a side effect, but being allergic to a drug is always a contraindication as well. There is no contraindication to the use of Narcan. Even if the patient is unconscious, it's an atomized spray up into the nasal membranes, and so there's not an airway problem. Oxygen has none when it's used to correct hypoxia. It is important to understand that when we get into chest pain, we'll talk about the fact that if a patient is breathing okay and has a pulse ox above 95, you don't use oxygen, but we'll get there when we get there. Rescue inhalers, there's none when using the patient's prescribed inhaler. Be sure to assist him with the rescue inhaler, which means he may or she may have trouble squeezing it, so you're going to help them. And it's an aerosolized powder. It's not a suspension. It's a solid in a gas, and so you have to shake it, which puts the powder back up into the pressurized gas so that when you squeeze it, it goes out. Remember the steps in helping your patient to use an EpiPen or an inhaler. For an EpiPen, you remove the cap. You inject it into the outer thigh. The clothes can be on. That doesn't matter. Wait 5 to 10 seconds with it in place and then remove it, and then go ahead and rub the thigh. For the inhaler, you remove the cap, add a spacer if needed, shake the inhaler, have the patient exhale, then take a breath in. When the patient takes a breath in, you squeeze the inhaler, and then the medication will go in. It can be tricky. You've got to get the medication going in and the inhaler pressed just as he takes a breath in. Let's try a question. You're treating a patient with chest pain. Vitals or blood pressure of 88/60, respiratory rate of 24, pulse of 110, pulse ox of 92. Patient has a history of diabetes and is allergic to aspirin. What should you do next? Oxygen, aspirin, nitro transport, oxygen, nitro transport, oxygen, glucose transport, oxygen and transport. You cannot give aspirin because the patient's allergic to aspirin. You can't give nitro because the patient's blood pressure is too low. You're not going to give glucose because there's no reason to give glucose just because he has a history of diabetes. So actually the correct answer is D, just oxygen and transport. Remember to read the question slowly and carefully. Disregard all those distractors. Answer the question that's being asked. Study hard and do well.